Good morning. Today's journal club is effect of dapagliflozin on metabolic dysfunction associated steatohepatitis or MASH. This is a multicentre, placebo-controlled, double-blind trial. Came in BMJ 2025. And as we know, the sodium glucose cotransporter 2, which is situated in the proximal convoluted tubule, causes reabsorption of glucose into the bloodstream. So here you can see the cotransporter that will produce reabsorption of the glucose so that the glucose will not appear in the urine. When you are blocking SGLT2, the glucose will be excreted via the urine. That is a mechanism. And the common drugs are the canagliflozin, dapagliflozin, and empagliflozin. So the background, as we know, metabolic dysfunction-associated steatohepatitis or MASH, previously known as NASH, is a progressive liver disease linked with obesity, diabetes, and metabolic syndrome. There is no approved pharmacological treatment yet. Sodium glucose cotransporter 2, example dapagliflozin, will reduce the glucose reabsorption, as I have mentioned earlier, and it will reduce cardiovascular risk and renal risk, and it will try to, or it will reduce the liver fat. That is the postulation. The linked article is also present in the as an editorial in the BMJ. So what are the off-label use of SGLT2 inhibitors? As mentioned, there is no approved treatment, but off-label treatment of SGLT2 is in the non-alcoholic fatty liver disease by AAC recommendations. As an adjuvant therapy in patients with the type 2 diabetes mellitus and NAFLD. It is also used in the management of obesity in combination with the glucagon-like peptide 1 receptor agonist. So in this trial, the objective was to assess the efficacy and safety of dapagliflozin in adults with proven MASH. So adults with proven MASH by histopathology. The study design, as mentioned, it is a multi-center, double-blind, randomized placebo-controlled trial in China between November 18 and March 23. The participants were adults above the age of 18 years, MASH proven, with or without diabetes. There were 154 patients, 78 in DAPA group and 76 in placebo group. So that is about the study. What was the intervention? Intervention was DAPA 10 milligram once daily was given for 48 weeks. And a matching placebo was given for 48 weeks in the controls. And it was a double-blind trial. Now, what were the primary outcomes? The primary endpoint, MASH improvement without worsening of liver fibrosis at 48 weeks. And it is identified by the NAS score decreased by more than 2 or the NAS score becomes less than 3. NAS stands for non-alcoholic fatty liver disease activity score. And there is no increase in the fibrosis. These were the primary outcomes. Secondary outcomes were MASH resolution without worsening of fibrosis, fibrosis improvement without worsening of MASH, safety and treatment discontinuation due to adverse effects. So these were the primary outcomes, secondary outcomes. The results. The primary outcome, let us see the outcome of the primary. The MASH improvement without worsening of the fibrosis, seen in 53%. Whereas in placebo, it is only for 30% and was statistically significant. The rest is a secondary outcome. MASH resolution without worsening fibrosis, 23% in DAPA. It is MASH resolution without worsening, 23%. Only 8% in placebo. Fibrosis improvement without worsening of MASH. DAPA 45% and placebo 20%. Both were statistically significant. The safety profile was also assessed. Discontinuation due to adverse event, DAPA only 1%. Placebo 3%. No significant new safety signals were identified. So what is the conclusion? Treatment with the dapagliflozin resulted in a higher proportion of participants with the MASH improvement without worsening of fibrosis. MASH resolution and fibrosis improvement compared with the placebo. So treatment with the dapagliflozin resulted in a higher proportion of participants with the MASH improvements without worsening of fibrosis, MASH resolution and fibrosis improvement compared with the placebo. So what are the strengths of the study? It is an RCT, double-blind, multicenter, biopsy-proven MASH. The endpoints were clinically meaningful and intention to treat analysis. The limitations are it is limited to 6 hospitals of China, whether it is generalizable. Sample size is small. The duration was only 48 weeks for a chronic disease. So what are the implications? SGLT2 inhibitors may offer dual benefit for patients with type 2 diabetes and MASH, may become an option for MASH treatment pipelines. Further large trials are required. So take home message, dapagliflozin shows promise for MASH, improves steatohepatitis and fibrosis, safe and well tolerated. MASH management, if confirmed in broader populations, it may reshape the MASH treatment. Stay tuned for further journal clubs. Thank you.